Hi, I'm having Dr. Zaghiyan, amazing colorectal surgeon, with me today to talk about very controversial topic of vaginal delivery or VBAC as well.
Hi everyone, I'm Karen Zaghiyan. I'm a colorectal surgeon in Los Angeles, and I'm excited to talk about this topic today.
So again, as we were saying, it's a very controversial topic, and probably some will be very mad and some will be very happy. Based on my work, we know that vaginal birth can cause urinary incontinence, pelvic organ prolapse. But what about the bottom part? What issue could happen if you have a vaginal birth?
Yeah, I mean, it's under discussed, it's under reported. And obviously, as a colorectal surgeon, I'm biased. And I see many patients come in that have suffered trauma to their anal sphincters. The technical term for this is obstetric anal sphincter injury. And that's because when you have a vaginal delivery, sometimes women can tear into the perineum, but other times you can tear through into the anal sphincters, which are right just adjacent to your vagina. And occasionally patients can actually tear through and through into their rectum completely. And the big thing, the part that like my expertise comes in and like being able to like professionally weigh in on this is that I think the statistics that are generally discussed and generally available are majorly underreported. The actual incidence of obstetric anal sphincter injury is much higher than in the single digits. And there are several studies that have used ultrasound to go back and look at patients after they've had vaginal deliveries, presumed uncomplicated vaginal deliveries, with patients having up to like 35% rate of having their anal sphincters torn during vaginal delivery.
If you think about how the repair usually done when somebody delivers vaginally, it's in a room, in a dark room, a lot of people, you can get in normal exposure. Repair happens. And then also, as you mentioned, there are different degrees of the tear. First and second degree considered to be average and normal. Everyone can report that. But if you get to the third degree or fourth, it's considered the major complication. So hospital might be just too scared to report it. Um,
And
and
and I think just to add in, the other thing that, and the reason, we see this, I see this, right, is oftentimes patients who tear into the anal sphincters, they don't develop symptoms or know that that even happened to them until many years after the fact. It's not uncommon to have women come in their 50s and 60s, 20, 30 years, sometimes after they've had a vaginal delivery with bowel incontinence. And, we go and do an ultrasound and we find that sure enough, they have an injury to the sphincters that happened many years ago. And oftentimes people don't know to go back to their OBGYN and ask about this because they don't think it's a complication that's related to something that happened so long ago. So,
or even that vaginal birth can have any complication
right.
whatsoever, because vaginal birth is portrayed as this miracle that happens with everything like positive outcomes only, and nothing bad can come out of it. Also, going back to what you just said, that there is not enough education, not enough awareness of possible negative sides of the vaginal birth. So what about VBAC, vaginal birth after cesarean? Why do you so strongly advocate for not having VBAC?
Yeah. So, I actually posted about this on my social media, and I said that I would not have a VBAC. I'm a person who's able to sit and digest the information that's in front of me, but I think unlike a majority of patients making a decision, after they've had a C-section and now they'd really like to have a vaginal birth, I'm privy to information that I think sometimes is not, shared exactly to the detail that we see it and we know it and we're able to digest the literature when a patient is trying to make a decision. So when I look at it for myself, I did have, I will say, personal experience. I had a primary C-section for my first child. My child was actually breech. So I had an actual, indication to have the C-section, and I chose to have a C-section again for my second delivery. I could have had a VBAC. My second child was not breech and theoretically was, could have been amenable to having a VBAC. But as somebody who comes from the background and seeing, the complications and the underreporting, and honestly, um, the sequelae, the long-term sequelae of a sphincter injury that oftentimes is very difficult to repair. It's not like, oh, it's no problem. We'll just give you this medication or we'll do this little procedure and you'll be fine again. For a lot of patients that sustain an injury, the trauma could be very devastating and life-altering and lifelong. And it is higher that the risk of those injuries are higher in women that have a VBAC than those women that have a second C-section, obviously, or that in general, when you compare, obviously, to women that have their first vaginal delivery. So because there is a higher rate of these complications with a VBAC, and the fact that you have already been exposed to the complications of a C-section. Obviously, no procedure. We acknowledge that a C-section is abdominal surgery and comes with its own risks. But to me, the risk of having perineal trauma, pelvic organ trauma, injury to my pelvic floor elevators, anal sphincters was not worth the potential benefit of trying to have a vaginal birth. And if and it's not often that I get the opportunity to actually, have a discussion with a patient. And obviously everything is, when it comes to a patient, right? Obviously none of this here is actual medical advice, right? Medical advice always has to come with from your doctor who knows all the intricacies of your overall health. But in general, when I sit down with a patient, and I do get referred patients, to help with this decision, patients with anal fistulas, those who have previously suffered trauma to the pelvic floor, and helping them guide whether they go for another vaginal delivery or if they have a VBAC or whatever it is. You sit down and you go through all of this with the patient. But for me, I think in general, specifically, and why I'm picking on VBAC, I think is that the risk is so much higher than that of a primary vaginal delivery, as well as of having another C-section.
Yeah, I hear you. Absolutely. I agree with you. And I think we all, like both of us, has a privilege of knowing that other side, because majority of women, they always told about all the benefits of vaginal delivery and all the risk of C-section, but they never told about benefits of C-section and the risk of vaginal delivery. So I think even now when we talk about it, I don't think everyone understands that it's not only, oh, I peed myself a little bit, that the complications that you deal with, that you see patients with, has tremendous implication on their life. Like you mentioned, fistulas. Can you just explain a little more, like what's the common complication you see after the vaginal birth, after VBAC?
Yeah, so I mean, a fistula happens for two reasons, right? Either there's a very, very prolonged second stage of labor, and you see this more in, third world countries where women are left laboring for very long, and there could be erosion injuries of the fetus into, into from the vagina into the rectum that could cause a fistula. That we don't see so much in the US, but we do see fourth degree tears where women tear through and through into their rectum. And unfortunately, when that is repaired, one, the repair is not robust, meaning it does not hold long, and those patients are highly prone to incontinence, either early or later on in life. But secondly, sometimes if the repair does not heal completely, you can have an abnormal passage between the vagina and the rectum where you could be left with passing feces vaginally. And then, we have to try and repair that. And frankly, the repairs are not easy and not always, successful. Um, so yeah.
So basically, woman is walking around with a pad, but instead of having urine in that pad, which can also be there, there is a basically feces on the pad because you can't control it. So it's pretty life altering,
Yeah.
damaging condition. And I think also some women can like not able to hold the gas, they can control it. And again, it affects what you do. I actually had a patient who was beautiful, tall European woman, yoga instructor, but she had to stop doing what she's doing because she couldn't control her gas, she couldn't control her bowel movements. It's very huge effect on the quality of life.
Yeah, I just saw a woman. Actually, she had thought that she had had a second degree tear. She didn't even know that she had had a tear into her sphincter when she had her first baby 3 years ago, and unfortunately developed a rectovaginal fistula, a fistula between her rectum and vagina that she's been dealing with for 3 years. And this has significantly affected her decision to even want to have, that second child. And I saw her to kind of help counsel her on, whether getting pregnant again would have just general implications on the fistula, and what we could do to perhaps repair it. Should we repair it? Should she just live with it? There's a lot of discussion and things that go in on the other side.
So why do you think there is so much controversy around C-section? What it is with C-section, like you would think it just another
Yeah.
surgical procedure, like men go through many of different other surgical procedures. Why there is so much anger, frustration, and so many things unsaid when we talk about C-section?
Yeah, I mean, I think, it's perceived as unnatural. I think women want to have the experience of a vaginal, delivery. I think it's thought of as a beautiful process birthing that child. And for whatever reason, a C-section is diminished like that. I had the privilege of, being born to a mother who had a C-section and praised the glory of her C-section my entire life. So when it was time for me to have my child, I never had, that strong desire to have a vaginal delivery necessarily. I was not against it. I would have had it until, I learned and had the opportunity to make a decision myself. But I think that there's that perspective of it. And then, there are some people that, I guess the OBGYNs would recommend not doing repeat C-sections on, right? If you're somebody that, and maybe you can speak to this, if you're somebody that is going to have many children, right? Repeat C-sections does increase the risk of uterine rupture, right? But as does VBAC, correct? And so there is risk. It is abdominal surgery, but I think there are several things that we don't do good well. The hospitals don't do well in, facilitating the recovery of that C-section patient, and the expectation is that if you have a C-section, you're going to be hospitalized for 4 days, that you can't hold and carry your baby, that you can't get back to life, the same way that you would with a vaginal delivery. Although, life with a tear down there is not exactly glorious and an easy recovery either. So I think when you weigh the bad of the C-section versus the bad of the vaginal delivery, again, when it came to me, and having seen and been consulted, and helped with cases in both of those circumstances, I felt like the bad of the C-section was less bad than the worst thing that can come of a vaginal delivery.
I hear you. I also get patients who come to me to ask whether they should have a VBAC or should have another C-section. And I do tell them, let's tell me what's important for you. Are you planning to have 2 kids? Or are you planning to have 7 kids? It's a huge difference. If you're planning to have 7 kids, try to have a vaginal delivery. Whatever damage happens. We can repair it. Obviously, no repair is 100%, but again, it's better to have a vaginal birth 7 times than 7 C-section.
Yeah.
And also, like, what experience important for you? Is the experience of birthing the child vaginally is the life goal, and it's very important? Okay, do it, but have the knowledge. Let me tell you what could happen if things go wrong. Similar way how the fetal maternal medicine or general OBGYN educate women that, okay, if you have too many scars on your uterus, there is a risk of uterine rupture, there is a risk of abnormal placentation, meaning placenta grows through the uterus and can affect other organs. But they don't tell you, like, hey, there is a pretty huge percentage of chances that you will develop incontinence after vaginal birth. So I think there is no really informed consent in a consent for having vaginal birth. And if we would do better, I think women at least would know what to expect and they wouldn't feel so isolated after having vaginal birth and suddenly start peeing and pooping themselves.
I mean, 100% of patients that come to see me after the fact, after they have suffered the injury, say they didn't know
Mhm.
and they wish they had known that maybe they would have chosen different.
Yeah. Well, we can control what the OBGYN tells the women, but what would you advise women to think about or what questions to ask when they stand between, like, when they stand in front of the decision having VBAC versus having another C-section?
I mean, I think the most important thing to ask your doctor is to give you what's the worst thing that can happen from this approach and what's the worst thing that can happen from that approach. And then the other thing I really like asking is if they've had either complication and what your doctor would do to help you, if that were to happen. Like, what happens if I do have a uterine rupture? What happens if I do have a fourth degree laceration? What are some things that you're going to watch for as I'm laboring to make the decision if we're, going to abort the plan for the VBAC and go to C-section? At what point are you going to make the decision? I think kind of just knowing what to expect going into it and honestly how your doctor will handle the bad outcome if it was going to happen is really important. I think and you'll get a sense as to how your doc feels about that complication or the question that you're asking. If they completely blow it off and say don't worry about it, that's not going to happen, I would question that honestly. Whereas if your doctor comes back and says, listen, it's not that likely, we're going to look out for it. I do think you're particularly lower risk than the average person for having this bad outcome because of X, Y, and Z. And I think if you want it, it's a reasonable choice, but we can always maneuver and make an appropriate decision as we go along the process. I think for me, that would be a, answer that I would feel comfortable with and feel like, okay, we have a plan.
I see. And I think it's also important to give women permission to consider C-section as their primary or repeat C-section because there is so much stigma around it. And I think both of us is a good example that C-section, not the end of the world. It's actually a blessing in many different reasons. You do not recover forever. I actually went home after both of my C-section, like next day.
They
Yeah.
were. Yeah.
Yeah. And I was able to carry my kids, the strollers and everything when you're prepared for that. So it's okay to consider, nothing wrong with that. I think another thing is that the society makes it very much C-section like as a bad thing because even in the hospitals, before you're able to schedule your elective C-section, you have to attend this 4-hour workshop where they tell you how bad C-section is. So it's all okay, and we're in 2025, and we are, as a women, we able to decide how we want to have our kids.
Oh, yeah, definitely. I think, it's not easy speaking about it. It's not easy opening up about like my own personal self and things that I've chosen about myself, because then you're, a target for people to comment on or whatever. I'm not putting my values on somebody else. I think everybody just needs to think about it and make a decision. But saying I chose this and this is what I chose for myself, I think just opens it up for somebody else who is thinking that to say, oh, why is that? And why would she say that? She's a colorectal surgeon. Why does she think that? And it just helps people understand the whole picture rather than just little pieces of information that you may be gathering from other places.
Of course. And again, for all the people who chooses to have a vaginal birth, we're also in support for you, and we're here to help if any of the issues happens. You from the colorectal perspective, I'm from urogyn perspective, but also for women who choose to have a C-section, we also hear you, and we're here to answer any other questions that you might have. And thank you to you for doing such a great work on showing what can happen, what conditions are out there, and what can be done if those conditions developed. So I think it definitely makes women more informed. Thank you so much for doing it.
Okay, bye. Take care.
Bye-bye.
Okay, bye.